She was just crying, and when she finally calmed down, she said her ear hurt really bad.
The doctor will be in just a minute. Stay brave, Kylie. We're going to take care of you.
Pediatrics is one branch of medicine that demands a focus beyond the individual patient and immediate health problems. Pediatrics must focus on the developmental stages of the child over time, on the child's position within a family, on the unique cultural characteristics of the family, and on techniques of assessing and providing care in ways that minimize the trauma and upset to children who often do not fully understand what is happening.
Hey Kylie, how are you doing today?
No, not good.
This program on pediatrics will discuss the characteristics and developmental stage of preschoolers as defined by the American Academy of Pediatrics, including some of their physiological characteristics and some appropriate forms of care. We will discuss ways of working with the entire family, since they are, after all, the experts and primary caregivers for their own child. We will discuss dealing with psychosocial and cultural differences and how the pediatric nurse must be aware of these and incorporate them without bias into an objective assessment. And we will discuss some methods of non-traumatic physical assessment and care techniques for use with preschoolers. Children are considered preschoolers or young children from about 3 to 5 years of age. Preschoolers are entering a period of energetic learning and acquiring a sense of initiative and skills like dressing.
I don't know what it is. He just won't share with his brothers.
Well, he's just entering the age where he can begin to share and learn the difference between right and wrong. You just need to develop a secure set of boundaries.
At this age, their minds begin to use symbols, and they play with imagination, fears, and stories. A sense of time and cause and effect are only incompletely understood, and preschooler logic has sometimes been described as magical thinking. They identify with their parents, but the individuation and separation process becomes powerful, and they grow more independent and are much more willing to be around strangers. Language and all social skills become much more complex as they leave behind the negatives of the terrible twos. They can dress themselves, though they may need help with complicated items, and their play becomes imaginative and often gender-based.
I'm afraid that he's going to be fat because he likes to put peanut butter on almost everything.
Well, this is a good age to begin reducing the fat in his diet.
Studies are increasingly showing that eating habits that lead to obesity, coronary heart disease, and diabetes are often set at the preschooler age. Parents should be encouraged to develop and model a balanced diet high in fiber, fruits, vegetables, and 2% milk. Children who develop the habit of eating candy and fatty snack food at this age may never break the habit. At this age, children begin to play with much more dangerous toys such as bicycles and skateboards. Parents should be encouraged to explain potential hazards and provide and insist upon safety equipment such as bike helmets and knee pads.
People die if the ear hurts.
Do people die if their ear hurts?
Yeah.
No, you'll be just fine. Don't worry, okay?
Preschoolers are very quick and imaginative and may become frightened of medical implements and exaggerate a small injury or procedure into a major event, such as losing a limb.
Kylie, I'm going to need to look in your ear really quick.
In a clinical setting, always explain what you're going to do in a firm and direct way before you start. Don't lie to the child about whether something will hurt, but reassure them that it won't hurt for long. You may be able to use games or distractions like colorful stickers to divert attention from frightening procedures. And the healthcare worker must remain alert for any signs of child abuse and forms of other maltreatment. Do not confront the parent or caretaker, but any signs you observe must be reported following your institution's or agency's procedures. Children now have their full set of deciduous teeth and should be encouraged to learn good habits of tooth care, though they will probably need parental help with flossing. A drop of toothpaste with fluoride will help protect teeth. Children should be taught to always spit out toothpaste and not to swallow it.
You may find her getting more aggressive and rebellious at this age, like maybe on the playground. That's pretty normal.
Parents should be prepared for a period of great transition for the child that may include rebellions, aggression against other children, plus fears of loss and the possibility of nightmares and other sleep problems. The preschool child is learning fast, and parents should watch for signs of stress and help them cope. With preschoolers, the family should be included as much as possible in healthcare discussions and decisions, and you must remain sensitive to cultural differences on many issues.
She's only 5 years old and she wants to put on lipstick. I know some children do that here, but it's not part of our culture.
Many people in America tend to feel that the way our culture behaves is the way all cultures should behave. But every society is unique, and every immigrant group has to make its own accommodations at its own pace with the general American culture. As cultural groups adapt to living in a different society, the changes can involve both losses and gains. Listening